Welcome to the deep dive. Imagine this. You walk out to the pasture, and your horse, usually so full of life, seems, well, off. Maybe a little tired or constantly shifting weight from one hind leg to the other, maybe lying down more than usual. You're worried, right? Something just isn't quite right. Today, we're doing a deep dive into a really fascinating and sometimes honestly heartbreaking condition that can cause those exact symptoms.
Yeah.
Equine Motor Neuron Disease, or EMND.
Right. EMND.
What's truly remarkable, almost counterintuitive really, is that this devastating neurological issue, which looks so complex, it often boils down to something as seemingly basic as a horse not getting enough of one specific vitamin.
It's quite something.
It's just a stark reminder of nutrition's profound and sometimes hidden power.
That's a really crucial point you make. EMND is what we call an acquired neurodegenerative disease. So essentially, it attacks the somatic motor neurons. You can sort of think of these as the critical electrical cables running from the horse's brain and spinal cord straight to their muscles, telling them exactly what to do.
The command lines, basically.
Exactly. And when these cables start to fray and break down, the muscle loses its connection. That leads to progressive muscle weakness and atrophy, wasting away. Now, while it does share some broad similarities with human conditions like ALS, it's really important to note that in horses, EMND typically only affects the lower motor neurons.
Lower motor neurons.
Yeah, meaning the damage is mostly to those direct connections, not usually higher up in the brain itself.
Okay. So let's unpack this.
Yeah.
Our mission for this deep dive is to really unravel what our sources are telling us about EMND, from its kind of mysterious origins to the unique signs an owner might spot, right through to diagnosis, treatment, and really importantly, prevention. It's just truly eye-opening how something so fundamental like a nutritional deficiency can hit an animal as big and powerful as a horse so hard.
It really is.
All right, so we've kind of established what EMND is, at least at a high level. But to really grasp its impact, we need to go a bit deeper. What's actually breaking down inside these horses when EMND takes hold? What's the fundamental pathophysiology driving these symptoms?
Okay, so at its core, and while the exact chain of events isn't 100% proven, there's an incredibly strong link between EMND and a prolonged deficiency of a specific type of vitamin E.
Vitamin E.
Specifically alpha-tocopherol. What happens is that the cell bodies of those lower motor neurons, the ones located in the spinal cord and brainstem, they begin to degenerate. We think this is primarily down to a process called oxidative damage.
Oxidative damage, right? That's a term you hear thrown around a lot. Can you maybe break that down simply for us? Is it basically an imbalance, like where the body's protective stuff, like vitamin E acting as an antioxidant, just can't keep up with the harmful elements?
That's exactly it, yeah. Imagine your cells are constantly being sort of bombarded by these tiny, unstable molecules. We call them free radicals. Vitamin E is a crucial antioxidant. It basically acts like a shield, protecting cell membranes from the damage these free radicals can cause.
Right.
So when there's a chronic lack of this shield, these free radicals build up, and that leads to this oxidative stress that seems to preferentially target and destroy those vital lower motor neurons.
Preferentially targets them. Why those ones specifically?
Well, here's where it gets interesting. The nerves going to the horse's postural muscles, the ones constantly working just to keep them standing upright and balanced, they seem to get hit the hardest.
Oh.
These muscles are rich in what we call type 1 fibers, which are like the endurance runners of the muscle world. They're highly active metabolically, and that makes them more susceptible to this kind of oxidative stress.
So their nerves are more vulnerable.
Precisely. And this oxidative stress also causes a kind of cellular rust or debris called lipopigment or ceroid to build up. Imagine it like a sludge accumulating in the cells, messing up their function. You can sometimes even see signs of it, like brown streaks, during an eye exam.
Wow. So it's not just general weakness then, it's these specific posture-related muscles being disproportionately affected. That makes sense with the weight shifting.
Yeah.
But how? Given how vital vitamin E is, how does a horse, an animal basically designed to eat greens, become so profoundly deficient?
That is the million-dollar question, isn't it? And it really comes down almost entirely to their diet.
Diet, okay.
Most horses diagnosed with EMND have a history of being kept without access to fresh green pasture, and often without leafy green hay either. for quite a long time, at least a year, often longer. Some sources even say over 18 months.
18 months? Wow.
Yeah. Fresh green forage is the natural richest source of bioavailable vitamin E. So horses fed primarily on dried grass hay and maybe some concentrate grains without proper supplementation, they're the ones at the highest risk.
It's really about lack of fresh green stuff.
Exactly. And while you see EMND worldwide, it tends to be more common in areas where horses might not get year-round fresh pasture or high-quality alfalfa. Think the northeastern USA and Canada, or sometimes in more urban environments where turnout is really limited.
Right, makes sense.
And interestingly, some studies also suggest that maybe high levels of pro-oxidant minerals in the diet, like iron and copper, especially when combined with low vitamin E, might make things worse.
Huh. Anything genetic?
Doesn't seem to be. There's no known genetic basis, and really any breed can be affected. The average age is around 12 years, but we see it anywhere from, say, 2 to 25 years old.
Okay. So let's go back to that initial worry we talked about, seeing your horse constantly shifting weight. What does EMND actually look like day to day? How might an owner spot it, especially early on when the signs might be subtle?
Yeah, the signs often creep up gradually, maybe over weeks or even months, which is why they can be easy to miss at first. The key characteristic is a generalized weakness, but importantly, without ataxia.
No ataxia. So they're not clumsy or uncoordinated.
Exactly. They're not stumbling or tripping in that sort of neurological way. We often talk about subacute and chronic forms. In the subacute form, which comes on more suddenly, horses might develop this acute onset of trembling.
Trembling, like shivering.
Yeah, or fasciculations. Those are like fine, rippling muscle twitches you can sometimes see under the skin, and they tend to lie down a lot more than normal.
Okay.
You'll often see that frequent shifting of weight in the hind limbs, like they just can't get comfortable standing. Sometimes abnormal sweating, too. Their head carriage might be low, and they might actually look less comfortable standing still than when they're walking.
Less comfortable standing. That's interesting.
It is. And one of the most perplexing things for owners, and really heartbreaking, is that even while their horses are literally wasting away, getting emaciated from muscle loss, their appetite often stays completely normal.
Really? They keep eating well.
Sometimes they even eat more. This isn't a horse giving up on life. It's a silent internal breakdown. Makes it particularly insidious, you know? Owners might even notice some weight loss just from muscle mass shrinking maybe a month or so before these other more obvious signs pop up.
Wow, that's tough. Eating normally while wasting away.
Yeah.
And if those early signs are missed, or if it isn't caught early enough, you said the subacute form can become chronic. What does that look like?
Yeah, in the chronic form, that trembling and the fasciculations, they tend to ease off. The horse sort of stabilizes, but they're left with varying degrees of muscle atrophy, that muscle wasting we talked about.
Okay.
This muscle loss can be quite noticeable, especially along the top line, shoulders, triceps area, and it's typically symmetrical, affecting both sides equally.
Okay.
In severe cases, the horse can look really emaciated, even though they're still eating fine. You might also notice their tail head seems elevated, held in a high resting position.
And movement.
Well, while they aren't truly ataxic, the underlying weakness can lead to a sort of shortened, choppy stride, maybe some toe dragging. And again, interestingly, they may actually move better than they stand.
Because standing uses those weak postural muscles constantly.
Exactly. Standing still requires constant work from those muscles that are being affected the most.
This sounds incredibly challenging to diagnose because, like you said, some symptoms, especially that weight shifting, I mean, I can imagine an owner seeing that and immediately thinking laminitis.
Oh, absolutely.
That must be a really common thing vets have to rule out first. So how do they confirm it's EMND? What tests are involved? How do they differentiate it?
You're spot on. Ruling out other conditions is a huge, critical first step because of that symptom overlap. Diagnosis really relies on a combination of things. The clinical signs we've discussed, a really detailed history, especially focusing on diet and pasture access.
Right, the vitamin E connection.
Precisely. And then specific diagnostic tests. Blood work to measure the plasma alpha-tocopherol concentration is crucial. Low vitamin E levels are highly suggestive, particularly in those subacute cases.
But not always definitive.
Good point. It's worth noting, some horses with EMND might actually have normal vitamin E levels when they're diagnosed, maybe if supplementation just recently started. So a normal level doesn't completely rule it out on its own.
Okay, so what's more definitive then?
The most definitive diagnostic test available is usually a muscle biopsy. It's often taken from a specific small muscle located over the tail head. It's called the sacrocaudales dorsalis medialis.
Bit of a mouthful.
Yeah. But this particular muscle is chosen because it seems to be consistently affected early in the disease process, and it's relatively easy and safe to biopsy.
And what did that biopsy show?
Well, under the microscope, the histopathology, looking at the tissue, reveals this characteristic neurogenic atrophy, especially of those type I muscle fibers we mentioned earlier. It shows changes consistent with nerve damage. Sometimes a biopsy of a nerve itself, like the spinal accessory nerve, can also show consistent lesions.
So when a vet is trying to differentiate, what are some key differences they're looking for to rule out things like laminitis or maybe other neurological issues?
Yeah, that's where the nuanced history and a thorough exam really come into play. For instance, colic often gets considered because horses might stand for only short periods in that subacute EMND phase.
Right, looking uncomfortable.
But a normal appetite and normal manure production in EMND usually helps rule out a major abdominal problem. Laminitis, like you said, is a big one because of the constant weight shifting. But with EMND, the horse often moves quite easily, sometimes even wants to walk, which is totally contradictory to the obvious pain and reluctance to move you see with laminitis.
Okay, that's a key difference.
Definitely. We also differentiate it from, say, botulism. In EMND, the appetite's normal, the tail head might be elevated, and you don't typically see cranial nerve problems like difficulty swallowing, which you can see with botulism.
Right. What about other muscle diseases?
Good question. Chronic myopathies like PSSM polysaccharide storage myopathy can look very similar sometimes. A muscle biopsy might actually be needed to tell them apart because they both involve muscle changes.
EPM. Equine protozoal myeloencephalitis.
Another important one. Unlike EPM, EMND causes symmetric muscle weakness and atrophy, usually without ataxia, and muscle enzyme levels are often normal in chronic EMND cases, whereas they can be elevated with EPM or other myopathies.
Okay.
And maybe one last one. If there's severe muscle wasting, but the appetite is normal in that chronic form, we might think about intestinal malabsorption.
Like they're not absorbing nutrients properly.
Right. But usually, plasma albumin levels are low in most of those gut syndromes, whereas albumin is typically normal in EMND. So each condition has its own sort of subtle tells the vet looks for.
Okay, so a lot to piece together. If EMND is diagnosed, what's the plan then? Can we actually fix this, reverse the damage, or is it more about managing the condition?
It's primarily focused on addressing that underlying vitamin E deficiency and providing really good supportive care. The most critical part is vitamin E supplementation.
Makes sense.
The goal is to rapidly boost those levels and then maintain them. Now, the absolute best way to provide this, immediate and ongoing access to fresh green pasture. That's the richest natural source of bioavailable vitamin E, hands down.
But if pasture isn't an option, or limited,
then supplemental vitamin E is essential. And here's a really crucial detail. You must use natural D-alpha tocopherol. It needs to be in a highly bioavailable form.
Natural form, why is that so important?
Because the synthetic forms of vitamin E, they're just much less effective at actually raising the levels in the horse's blood. They're really not recommended for therapeutic use in these cases. Water-soluble liquid formulations of natural vitamin E are often preferred, especially initially, because they get absorbed quickly in acute cases, helping get those levels up fast.
And the doses, are they high?
They can be quite high at the start, yeah. Maybe 5,000 to 10,000 IUs per day, sometimes even higher depending on the horse and the levels. And this supplementation is usually lifelong for horses that continue to have limited pasture access.
Lifelong. Okay. Beyond the vitamin E, which is clearly central, what kind of supportive care do these horses need? You mentioned that. Are there physical therapies or other things for their comfort?
Yeah, supportive care is vital. It gives them the best shot at recovery and just helps maintain their quality of life. For horses, spending a lot of time lying down, deep, comfortable bedding is really important to help prevent pressure sores.
Makes sense.
Ensuring they get enough calories and protein is also key. Help support whatever muscle mass they can retain, especially with that increased appetite we mentioned.
Right.
Gentle, controlled exercise, maybe just hand walking, can help maintain some muscle tone and stimulate circulation once they're a bit more stable, but definitely avoid intense exercise.
And riding.
That's a really important point. Horses with EMND are generally not considered safe for riding. They can have unpredictable weakness, and that poses a significant risk to both the horse and the rider. It's just not worth it.
Okay, that's crucial safety information. And what about prevention for other horses on the same property? Or, I guess, the long-term prognosis for a horse that does get EMND. Once those nerve connections are damaged, can they ever truly regenerate?
That's the tough part. Once those neurons, those nerve cells are lost, they can't really be replaced. So prevention is absolutely paramount.
Right.
Any other horses kept under similar conditions, meaning limited access to fresh green pasture, should definitely be supplemented with natural vitamin E as a preventative measure.
Proactive nutrition.
Exactly. As for prognosis for an affected horse, it's pretty variable. Roughly 40% of affected horses do show some improvement in their clinical signs, especially if they're treated early on.
Okay, that's somewhat hopeful.
It is. Some might even appear almost normal within a few months, but they usually retain some degree of muscle atrophy and probably won't return to their previous level of exercise tolerance.
And the others?
Another 40%, roughly, they stabilize. Their condition doesn't get worse, but they retain significant muscle atrophy and weakness. These horses can often still have a good quality of life, as pasture companions.
Okay, and the last group?
Unfortunately, about 20% or so continue to progress despite treatment. They just keep getting weaker and may sadly require euthanasia due to severe debilitation.
That's tough.
It is. And even with improvement, it's important to remember many horses will have permanent muscle atrophy and weakness. And again, generally considered unsafe for riding. Early intervention really offers the best chance for improvement before that irreversible neuronal damage gets too extensive. And lifelong management of their vitamin E status is often necessary. It just truly underscores how critical proactive nutrition really is.
Okay, so to kind of wrap up this deep dive then, EMND is this serious neurodegenerative disease in horses. It's primarily caused by a prolonged vitamin E deficiency, specifically alpha-tocopherol, leading to oxidative damage of those lower motor neurons.
That's the core of it.
The key signs you need to watch for are generalized weakness, and that symmetrical muscle atrophy, often with muscle tremors, the weight shifting, maybe a camped understance, but crucially, without true incoordination or ataxia.
Exactly.
Diagnosis usually hinges on that combination of history, especially diet, low vitamin E levels, and often a specific muscle biopsy from the tailhead area, and treatment. It's all about aggressive vitamin E supplementation. And it has to be the natural, highly bioavailable form alongside good supportive care and careful management, like avoiding riding.
Spot on.
And while those lost neurons can never be replaced, getting onto it early with careful management can make a huge difference in a horse's quality of life. It allows many to stabilize and live comfortably for years, even if their performance days are over.
Yeah.
It's just such a powerful lesson in the foundational impact of seemingly simple nutritional bits.
Absolutely. And, this deep dive into equine health, it really highlights this intricate, sometimes really surprising connection between diet, environment, and complex neurological function, not just in horses, but really across all living beings. It maybe encourages us and you listening to ponder the profound power of just fundamental nutrition in preventing serious illness. Maybe it sparks some curiosity about other species or even areas of wellness you might explore further in your own health journey.